Alright, this video is going to be about home health versus long-term care versus the hospital setting. I really can't tell you a whole lot about the hospital setting, even though that's where I started out as a CNA. Um, I have about 8 weeks experience working in a hospital, and keep in mind I was probably 16 years old at the time. Uh, that summer that I worked as a CNA first in 1987. So I really don't have a, but the skills and everything that I did in the nursing home or do in the nursing home is the same as I did in the hospital way back then. The hospital that no longer exists in this town anymore. Uh, yeah. Uh, you do vital signs, you pass ice, you bathe people, you assist with meals. Um, It's just basically the same thing, that I learned way back then in the 80s. Same routine. And when I went to become a CNA, certified CNA, but in '96, it was the same thing. I mean, except that I did classroom training and had to go take a test and be certified. But the everything I did back in that summer of '87 is the same thing I learned to do in the nursing home, working the long-term care environment. And that's where most of my experience lies, is with long-term care. Uh, that's what I'm used to the most. Now, home health. I like home health, but and I found a good company. Uh, when I left my home-based facility in 2012, like I said, I was making 835. I found an opportunity with this company called Professional Case Management. Their base office was in Denver, Colorado, but they had one case in this part of Tennessee. Uh, she had worked in Oak Ridge. It was like a governmental lab, so she got the benefits of federal government. And this company only dealt with patients of that or people that had worked in that lab or similar work like that lab, not just in Tennessee, but I imagine all over the United States. The case was in this area. She was the only case, I imagine, within 100 miles or more. So I found that opportunity. Believe it or not, I found this opportunity on Craigslist. Yeah, this was on Craigslist. I applied for it on Craigslist. They called me, did a phone interview. I think I was working within a week. I mean, they did the background check. Everything was done within days. And that job, when I started was October. I can remember the day, because it was on a Halloween when I started that job. I started Halloween night because it was 11 p.m. to 11 a.m. the next morning. So I started Halloween night 2012, and they gave me. I went from 8.35 to $13 an hour with this company. Um, and again, at the end of the day, it's about that money. So that little almost $5 raise in per hour, that was it. I didn't have to think about that. I mean, I just thought, okay, I'm gone from nursing home. I think I gave my 2 week notice and everything. But anyway, I left. I left my home base, and that job lasted 3 years. I worked there with that one particular patient in her home for 3 years. I would work the night shift. Then this one other, and she's on the group with us, the uh, CNA group that I have on Facebook. She's on there, and she can relate to this too. Um, One thing I thing, the problem was this little lady, even though she could not be left alone because of her health, she liked to go back to her home that base where she lived for more than 32 years. She liked living near the water. She lived in St. Pete, Florida for many years and near the water, near the ocean. So she would go back occasionally and stay gone a week. Okay, when she went and stayed gone a week, that left us with no pay. And she did that about I'd say the second or third year. I think about the third year of probably about 2015 or somewhere. Anyway, somewhere in that time frame, she started going. And I think she did that about twice. I think she did started it in 2014. She went and stayed gone a week. And then the CNA staff, they just didn't have any pay once she did that for that week she was gone. And that got me to thinking, okay, now what if this lady gets sick or passes away? What am I going to do? So that got me to thinking. I went on with it for another. I worked with that at that job. I know even after I went back in the nursing home, I was still working at that job uh, part time. I still worked there uh, 3 days a week, 12-hour shifts, which was still full time. Still was working full time. And about December, it was somewhere in that time frame she got real sick. Was in the hospital, and that they had put her on hospice. Uh, yeah, she was on hospice. They thought that she was getting ready to go, but she didn't. She lived another 5 or 6 years. But they really, after that, they did away with the CNA's position. They felt like the nurses, the RNs, and the LPNs could do everything. So there went that job. But I had already wised up before that happened because I had already started working at the long-term care facility or long-term care where I know the job would be more stable. It wasn't nursing home, but it was, you know, it was in a facility. And I started working there in about December, I think, of 2015 was the last time I worked in that home with her. Uh, it's totally different kind of home health care because, like I said, that was federal. The federal government gave $1 million a year for her care, and that took care of the home health services, her health, paid for all the staffing and everything. Doctors, she was just well taken care of. She had 24-hour care. She was never to be left alone. During the day, there was LPNs, RNs there, and at night there were CNAs that spent the night with her and looked out for her. Oh, but like I said, home health. All the other companies is different. It's different kind of, they don't really stay 12 hours unless it's private pay. The government does not really cover for 24-hour care. Um, if you do stay 24 hours, it's usually because a family member or somebody is private pay. Insurance, most Medicare and insurance like that, unless you got long-term care insurance, will not cover for a patient or resident to have 24-hour care. That's going to have to be out of pocket or paid through a long-term care insurance policy. And that was with the home health. Like I said, it's if you could find a good company like that, then when they got several clients in the area, that like that was they were paid through the federal government and those kind of, but you don't. It's not any in this area. Like I said, that company was out of uh, it was out of Denver, Colorado, and I hadn't seen another opportunity like that. That was once in a lifetime thing. And, I enjoyed those 3 years there with her. She lived in a condo on the river, and at night, this I didn't like the idea. She lived in a like a closed-in community, lockdown community, and she would sleep with her. She liked all the window shades open, curtains, and well, until she went to sleep, she would watch the barge go through or the boats that come down through by the Tennessee River there. Because you just look out her window and you could see the river. She was just right on the bank of that river. Of course, she was very wealthy. Um, and that's how she lived in Florida. She lived in a condo near the water. So she always lived near the water. She loves the water. She loved the water. Um, then, as far as long-term care, that's what, like I said, that's why I ended up just back into long-term care because it's more stable. As far as your work hours, you're gonna always pretty much you ain't gonna make a whole lot of money, but you're gonna have a job most of the time unless you do something mess it up for yourself or quit. It's more stable than home health. Uh, some people do home health and they do it for years and never do CNA in the nursing home. Um, but that's my experience with home health versus nursing home. As far as that stability, nursing home is more stability as far as your job. You know that as long as you come to work, do your part, unless that nursing home closes down, and that's hardly ever happens. I mean, it didn't happen in this area, but it can happen. But anyway, it's more stable than home health. But home health, the advantage you have with home health, you're only taking care of one person, and versus uh, 8 to 40 or however many you're assigned to in your given shift. Um, that's the difference to me as far as the two contrasts. As far as dependability is in work, you'll have a job. And that's about all I have on that subject as far as home health versus nursing home. All right. Toodaloo.